My name is Hari Prakash Boyd. I am the owner of Prakash Organics, an organic medical grade skincare line, and also a master esthetician. All right, so now we're going to go ahead and set up our field because we're going to do some numbing for Shannon. So again, I take another one of these disposable pads. If they're larger ones, you can feel free to cut them in half and use them this way if you like. Actually, I could do that if I'd like, but I'm going to go for like this for right now. And then what we're going to do is we're going to have our numbing product. This one's kind of low, so I have a backup. We're going to get our tongue depressors for application. And then we're also going to get pieces of saran wrap I cut up before I put my gloves on. The reason why we're going to use saran is because the saran is going to occlude the numbing. So the most important thing with microneedling is you have to get your clients numb. If you don't get them numb, they're not going to be comfortable. And if they're not comfortable, they're not going to want to come back and get more treatments. The other thing is to get the best outcome with microneedling, we need to get the pin into their skin as deeply that it allows for, like, you don't want to go too deep. You want to go deep as you possibly can in the areas that you can go deeper. So because of that, if they're not numb, again, we can't get down in there. And the remodeling with microneedling happens because you're going into the dermis and triggering that wound healing response. So we really want into that dermis. So one of the ways I have found that really gets people numb is I only work with a 5% numbing. The one I'm using today is Numb Master. Okay, it's just a 5%. I have used the really strong compounded ones at medical offices as well, and I actually feel that this works better. Also, it's way less drug in their system. A lot of practitioners and people who don't have medical licenses, we cannot get compounded numbing anyway, so 5% is the highest that we can use. The stronger ones also put a lot more drug into the skin, and you'll notice with microneedling that your clients can break out along their jawline after the treatment. This happens for two reasons. One, the treatment's really stimulating, it can cause purging. But it mainly, especially when it's right along the jawline, is because the skin is trying to detox the drug. So the less drug that we have in the system, the less chance of this like nodular, people call it cystic acne, that they're gonna get along their lymph nodes. So one of the ways I found that helps it penetrate the best is by occluding it, it prevents it from drying out. One of the things that happens when you put on the skin is it will start to cure. And when it starts to cure and get that skin on it, it no longer is being able to drop down into the tissues. So I'm gonna put the numbing cream on, occlude it with the saran wrap, and that way it stays moist underneath the saran and can actually go in and numb the client. All right, so now we're gonna go ahead and numb Van. One of the things I wanna point out is I do intentionally have only one glove on for this because I'm only gonna use one hand to massage it into his tissues. There's no point in wasting two if you don't want to. So you can take a tongue depressor or popsicle stick, whatever you have on hand. Today I have this one. I always try to stir the numbing up. I am using Numb Master. I am a huge fan of just using the 5%. And you're going to, okay, Van, this is gonna be kind of cold. I always let them know that the numbing is cold. It does retain cold temperatures, so it's just kind of cold. And if you tell them up front, it's not shocking. Okay, I'm gonna flip this over. I'm gonna dip again because I need more. And I'm just kind of placing it, and then what I'm gonna do is I'm gonna massage it exactly where I want it to be. And then I'm gonna occlude it with saran wrap. So I'm throwing away that one, I'm getting a new one, dipping it fresh in. Okay, I'm gonna toss these. I'm just gonna kind of work this around. I'm gonna go into her eyebrows because we're actually going to needle all of this in here, okay? Go up into the hairline. Make sure you're getting those bunny lines in there. You want the numbing to be as even as you can get it because the evenness is how the drug is gonna drop down into the tissues. Okay, see how close I'm getting? Be very careful not to get it into the client's eye. Numbing can corrode your cornea. So it absolutely will heal itself. It will not be a long-term damage, but it does hurt kind of like a son of a gun. And so I recommend that once they have the numbing on, they just lay here and rest. They're welcome to get up and go to the bathroom once the numbing's been on for a little bit and the saran is on. One of the things I want you to notice is how close I'm getting to the ear, and I'm gonna wrap around it a little bit because I want to over numb the area I'm gonna needle. So I'm probably gonna needle Shannon today to about here. So that's why I wanna numb her even lower. The reason we occlude the numbing is I want it to, one, be much easier to remove, and two, I want the active ingredient, which is lidocaine, to keep dropping down into the tissues. And once this stuff hits the air, it's going to start curing. And when it starts curing, the drug is not gonna be accessible to be absorbed anymore. So by occluding it, it keeps the product moist, it gets the client more numb, and it is a billion times easier to remove when you go to start treatment. Okay, so now I'm gonna take my gloves off. I'm gonna drop them in the trash. I've taken pieces of saran and cut it up. I do use scissors, I don't use the tearing at all. And I'm just gonna go in here and place this on in sections because I'm gonna remove it in sections. I'm going to allow this numbing to sit for about 20-25 minutes. And then what I'm gonna do is take the saran off, put another layer of numbing on, and let it sit for another 20-25 minutes. And then we will remove in sections and do the needling. This way, she is really, really good at numb. It does take, there's just no way around it. Numbing is 45 minutes. If you don't wanna take the time to numb them, your clients are gonna be so much more happy if you can get them numb. This is the most important part. I feel most important part. All right, so Van is right at the 20-minute mark. So what we're gonna do is we're going to take off this barrier film. We're gonna put another coat of the 5% lidocaine cream on, and then we're gonna cover him up again and let him cook for another 20 minutes. Right now he's actually taking a little lovely nap. He's so relaxed on the table. The reason why I do this method is I have found that when it comes to your clients, if you really want to get the best results and get as deep as you can in the appropriate areas, and you want them to return and get the treatment more than once, you have to get them numb. This is what will set you apart from other estheticians, dermatology office, medical spas, if you can get your client numb and then give them a really good treatment. When they're not numb, you can't go as deep. The depth is not as much. And if you're not getting down into that dermis, you are not making the changes and the remodeling in the tissues that you want to be making, which is the whole point of this treatment. If you are in a medical office and you are using the higher percentages and the compounded, you can just do the one layer, put the saran on, and leave it for 40 to 45 minutes. But with the 5% method, we do it this way. So what I'm gonna do is I'm gonna take her saran off, and I will just reuse the pieces that I have. It doesn't have to be beautiful, right? See how it still stayed completely moist and wet. It hasn't cured at all. The other thing is that when it cures, it's much harder to get off when you go to microneedle. It really does like this rolling and pilling thing. And so when it's moist, it's just much easier as well. Same thing, your stick. It's already pre-mixed from before. Here we go. And you can see his skin has drank some of the lidocaine already. There's not as much sitting on the skin as there was before. And you want to over treat the area that you're actually going to needle, because if you just, like we talked about earlier with the beard, if you only numb up to exactly where you're going to needle, you're not going to be able to get very deep. That's where the beginning and the ending of the numbing, and they're going to feel it. So I'm going to flip my stick around, grab some more product. When it comes to beards, I do just let the client know, hey, there's gonna get some numbing in your beard. I'm not gonna be able to get it all out during the treatment. It's gonna have to be cleansed out. It's not a big deal. Just when you wash your face tonight, you can do that. You can wash it out then. Notice how it's getting a little bit too close to his eye right here. So I'm just gonna take a Q-tip from my table and pull it up. There we go. Grab a new stick, grab some more medicine, and put it on. A little bit more, and then I'm going to use my hands to work it all around. You can get those glabellas, get down on that brow bone. Shannon, halfway through the last application, she did get up and go to the bathroom, had no issue. Okay, so this is the time with the second application that I want to bring it down on her neck. Okay, so now I'm going to treat her neck, and then once we go to microneedle, that's when I'll put the second coat on her neck. But we don't want her numbing to wear off too quickly, so that's why we're going to do the neck in stages. Just massage, massage. Take my gloves off. And we're going to put the saran back on. It's okay if I get a little numbing on my fingers. How's your skin feeling, Shannon?
It feels numb.
And then we have a new full piece that we're going to take and put on Shannon's neck.